Our topic is angiogenesis and cancer by Team 2. Our objectives in introduction will be to understand angiogenesis and the development of cancer, to understand the cell and molecular biology of the cancer, to understand Avastin, its drug targets, and the mechanism of action. Alright, so what is cancer? Malignant and invasive growth of tumor tending to occur after excision and to metastasize to other sites. Cancer can create too many blood vessels to develop, and which can feed cancer tissue and help it to metastasize. So the cell molecular biology of cancer is, like we said, angiogenesis is the ability to form new blood vessels. It's necessary for cancer tumors to keep growing and spreading, and it's a rapid tumor cell growth which creates intracellular hypoxia and poor oxygenation. One of the targets is VEGF, which is vascular endothelial growth factor. VEGF binding initiates angiogenesis, which causes endothelial proliferation and the formation of new blood vessels. Another part of the molecular biology of cancer is the HIF1 factor, which is hypoxia-inducible factor. One of the key regulators of oxygen homeostasis, it regulates the physiology response to low oxygen levels in the pathophysiology of cancer. It is the heterodimer protein that consists of HIF1 alpha and HIF beta subunits. This is a link that you can take a look at a video of angiogenesis. Alright, so of those, the drug targets are the formation of blood vessels is a key formation in the progress of solid tumors, providing nutrients for tumor growth and metastasis. A number of drug targets are currently being developed to exploit inhibition of angiogenesis and the therapy of cancer, inhibiting angiogenesis target blood vessels and not healthy cells. Continuing with drug targets, the process of angiogenesis is driven by the tumor's release of VEGF, and drugs to inhibit VEGF are already in use. VEGF binds to receptors in the endothelial cells of nearby blood vessels, causing them to proliferate and bud for the existing blood vessels and migrate towards the source of the VEGF signal. Angiogenesis is ineffective in blood cancers such as leukemia. So the drug that we're going to be talking about is Avastin. Its generic name is bevacizumab. The drug class is a monoclonal antibody. Avastin is not a chemotherapy drug. It's a tumor-starving therapy which starves the tumor of what it needs to grow and spread. Avastin is a recombinant humanized monoclonal antibody which inhibits the work by blocking a protein that we've been talking about, VEGF. Alright, so this is a diagram of how Avastin works. It's blocking the binding of VEGF to its cellular receptors, FLT1 and KDR, on the surface of the endothelial cells. By blocking VEGF, Avastin can starve the cancer by the food supply it needs to grow and spread. Blocking VEGF is one way to fight cancer. So administering Avastin can be given in an injection. It can receive an injection in clinical or hospital setting. The medicine can be given slowly through an IV infusion. It can be taken up to 90 minutes to complete, usually given every 2 weeks. Alright, so some of the drug interactions for Avastin, it's the metastatic colorectal cancer with 5-FU-based chemotherapy, non-squamous, non-small cell lung cancer with carboplatin and paclitaxel, metastatic breast cancer with paclitaxel, glioblastoma as a single agent for patients with progressive disease following prior therapy, and metastatic renal cell carcinoma with interferon alpha. These are some of the typical drugs in that same class, as you can see, covering breast cancer, lung cancer, and other cancers. Alright, so in summary, angiogenesis involves the growing of new blood vessels and is necessary for cancerous tumors to grow. Angiogenesis drugs binding to VEGF and inhibitors of VEGF for binding to the blood vessels. Avastin has been used in combination with chemotherapeutic drugs. Avastin should be avoided in patients experiencing wound healing problems, hemorrhages, or gastrointestinal problems. Here's some of the websites that we used in obtaining this information.